You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic is the keys to a natural looking facelift. We're specifically talking about the new low downtime deep plane facelift. He's been on the program before. He almost needs no introduction in the desert. Dr. Mo Zachary. Dr. Zachary, welcome to the program.
Thanks for having me, Randy. I appreciate it.
Now, for people that don't know you, board certified plastic surgeon. And how many years have you been doing facelifts now?
So it's crazy to say it, but I've been at it for 24 years now. And the first 5 years I was at University of Utah teaching, and then I moved out to the desert, and I've been in private practice ever since.
Okay, good. Now, you brought a stack of photos, and I'm trying not to side with you today, but we looked at some of them in the green room, and these are, I mean, they look good. People are going to see. I mean, some people look literally in their after like the daughter of their before. No kidding. So you don't want to look at this. Now, what's changed, by the way? Like when I first met you, I think it was like 2001, 2002.
Right.
What's changed?
Sure. So, over 20 years, just the numbers are with me, right?
Okay.
I do 300 surgeries a year, 100 of them being facelifts.
Wow. Okay.
And so, once you kind of have practiced enough numbers, and if you're patient, if you have the wisdom, but also if you have the inspiration to keep growing and educate yourself, such as going to meetings, or I go to different mentors and I watch them do surgery and I pick their brains. And anytime you go to one of these events, if you just come back with one little pearl of knowledge,
okay,
you're golden. It all sort of adds up. And over the years, the stitching techniques have changed. The plane of the facelift has changed.
What does that mean?
Well, so there's many different planes where you can get underneath the skin. You can just do a skin pull, or you can go in underneath the muscles, which is a deep plane, or you can do a composite plane where you can go all the way down to bone. And all of those techniques, I have had the privilege of trying them and observing the results over 20 years. 20 years is a long time, and so if you have the longevity, you can watch something grow and you can watch it bloom, or you say, okay, well, the patient had a little bit more swelling than I thought. It took them longer to heal, so therefore, let me go back and retool. And also, the type of stitches, the type of stitching techniques have improved. Now, for example, we're doing platelet-rich plasma. We're taking the patient's own blood and spinning it, synthesizing, pulling the platelets out of it, and then we're adding the plasma. We're injecting it into the tissues. So because of the PRP, the patients are getting that much more natural results with less downtime, a lot less swelling, much better healing of their tissues, with a lot less scarring underneath. So everything redrapes very nicely in the face and neck. So when they turn their face or their smile, everything just goes with the flow or the natural dynamics. The other thing that we're doing now, for example, is we're doing IV vitamins, glutathione, Myers cocktail, things like that, NAD, during the surgery, so that when the patient wakes up and they recover, they feel much better.
You're in Palm Desert. I mean, you have one of the largest centers in the Coachella Valley.
Yeah.
Is that correct?
Yeah.
What's a beautiful center? You guys call it CSI.
Cosmetic Surgery Institute, so CSI of Palm Desert.
Because at the top of the show, you were talking about the different levels of deep plane facelifts, skin pulls. So I guess it requires judgment. Like where you can look at a face now and kind of tailor what you're going to do based on their anatomy?
Yes.
Like, does that judgment just become that much better?
Yes, absolutely. So depending on, for example, if the patient is Caucasian versus olive-skinned versus South American versus European, their skin has different thicknesses. Their soft tissues under their skin has different texture. And so you, through experience, number one, where to cut, number two, where to undermine, and you know how tight of a stitch that you have to put, at what angle you have to put that stitch, and how deep you have to put it. So there's all these independent decisions that you end up making on the spot. And that used to be what kept me awake at night before the night before surgery. But now I'm excited because after 20 years of doing it, I can actually look at the patient and see the after results.
In your head, you could see it.
Yeah, and it's really cool because I feel like I have X-ray vision or something, and I can see the future.
Okay.
And that to me is really inspiring.
Very nice. Now, you've got a stack of photos, so I'm going to rush you a little bit.
Sure.
What are we looking at over there? And these are all like facelifts, deep plane facelifts?
Yeah, I included a couple of blepharoplasties and fat grafting to the face on men. But so this lady is in her late 60s. She came to me because she didn't like her neck, and but I mean that happens to everybody. Once we're at the age of 30, you start to lose collagen. 1% of collagen per year you lose.
Okay.
So by the time you have lost 25 to 30% of your collagen is when the neck starts to get ripply, or the arms and things like that. By the time you lose 30 to 35% of the collagen in your skin is when you bump something and then it kind of bruises, okay? So, unfortunately, it happens to a lot of people, and her jowls had started to fall. Yeah, and she said that, like when she's on Zoom calls or when she sees a picture of herself, she's surprised at how she looks tired, right?
Okay.
And the key caveat is she did not want to look different. She didn't want to look done. She just wanted to look more youthful.
Okay.
So what I did.
What'd you do?
Well, what I did for her is I tightened up her neck, and the way when you tighten the muscles effectively, you not only are tightening the neck, but you're also tightening the whole décolleté area. And then I came in and did a mid facelift on her and tightened the jowls. And then we did some fat grafting to her cheekbones and her lower lids. And honestly, when you look at her, she looks like herself, right? And by the way, she used to have the cutest dimples, and now you can see them again, right?
I can see it on the after, yes.
But I want you to show I want you to see her profile shots. So, you see the neck banding, and also the jawline has been cleaned up, right? But here are the smaller little details, like the earlobes are in place. They are not pixied down. And with her, the beautiful thing is the incision placement was perfect, and she can wear her hair up, and not even her hairstylist can really tell if she's had anything done.
So she's just about 70 years old. Mm-hmm. She looks great. I don't think people would ever guess that that's her age. Mm-hmm. And that will last for many, many years. I mean, she's going to, like if she had a twin sister, one had the procedure, one didn't, will she look noticeably younger into her 80s and beyond, in your opinion?
So the American Society of Plastic Surgeons did a really cool study where they took identical twins. One of them had a facelift, the other one did not. And with a deep plane, especially deep plane facelift, because you're putting the infrastructure, the foundation back in place. So then 10 years later, when they took pictures, yes, the patient had aged 7 to 10 years, but the identical sister had aged 10 to 14 years, so slightly more. Okay. So yeah, I mean, I always tell the patients, look, the aging process unfortunately continues, but I think for the most part, they keep their results as is, because you're essentially doing foundational work. That's the key.
Okay, this is an excellent one. Let's go to the next one.
Absolutely. So more and more men are coming in, and this gentleman came in, and he is, in his mid to late 60s. He's retired, but he says that his friends keep commenting that his eyes are saggy and they just look tired, okay? So I'm actually very proud of this procedure because
big difference.
Yeah, so what I did on him is he had multiple things going on. Not only did he have puffiness here that we took care of, but also he had these ligaments that were very strong. So I actually had to go in from underneath in the lower lid, and I had to release those ligaments, so then everything smoothened out. And then I lasered lightly underneath the lower lid so the skin tightened up. And I put a little bit of fat grafting in there. And that's the other thing, Randy. Over the years, I've learned to, increase the fat grafting someplace or decrease the fat grafting. And what happens is the fat graft produces stem cells. And so it actually rejuvenates the area wherever you deploy the fat. It increases blood supply. Therefore, physiologically, you're making the skin younger. So
It looks good.
yeah, thank you. He gets a lot of compliments. I have one more gentleman that I want to share with you.
Okay.
And he again came in, and he said he's close to retiring, but he wants to keep working another 5 to 7 years. But he just felt that his eyes looked tired. And so, what we did for him is I went in and removed the lower lid fat bags, and then I added a little bit of fat right underneath where he had that orbital rim was hollow, and he looked fantastic.
Looks fresh.
More importantly, both of these guys acted younger after the case. So that is key.
So is your theory that when you look in yourself in the mirror and you look younger, you start acting younger?
Oh, absolutely.
They tell you that?
Absolutely.
Can you tell, like they walk into your practice and they're just a little bit different?
You can tell, especially with the ladies, their makeup pattern, hair changes, their clothing changes. They just they get their mojo back, And it's really nice to see that. And they're laughing and cracking jokes with the office staff, with myself. So, yeah.
Very nice.
Yeah, absolutely. Okay. Now, this lady was on the verge of retirement, and she really hated her neck. And here's her profile. And that's just something personal. That's what, really bothered her.
But that's standard aging, right? I mean, your neck is going to go no matter what.
Absolutely. That is absolutely standard aging. But
like when you see her, by the way, on this consult, do you think, boy, this is going to be good?
Oh, yeah. Like I said earlier, I have gotten to the point where I can see the after results. And to me, that's the best part of my inspiration. And when I tell the patients, I'm like, just trust me. And they're like, well, you say that to everybody. I'm like, no, just trust me, because I've been doing this long enough to know that you're going to have excellent results. So what I did for her is tightening the neck. Once again, the décolleté area gets tightened, and she just was so happy. So, but look at the profile, because she did not, obviously she didn't care for her neck, but afterwards she is so happy. And this is one of those things that, her charm and charisma came out, her beautiful smile came out, and that will send ripples throughout your life. And you're gonna, the patients just blossom, and they blossom with, more important than anything else, they blossom with themselves. And when they blossom with themselves, then they blossom with their loved ones, okay? So this is the key. We all have an inner dialogue, and we're our own best friend, or we're our own worst enemy, because we talk, to ourselves, say, I can't believe you said that. That was so stupid. Oh, you look so ugly. Oh, your neck is old, this and that. But imagine after this procedure, that inner dialogue changes. And then you are complimentary of yourself, And then you start to become complementary towards life, towards everybody else around you. And that's the beauty of it. And people don't really think about that, and it just happens. I see it.
Yeah. So they come in just wanting to look fresh or a little younger. And the side effect is it's a boost to their self-esteem and their charisma.
Absolutely.
And do they go out more and travel more? And
yes.
You said some people get out of bad relationships. Some people start new relationships.
Absolutely. There are a lot of people that, you know, they get out of a bad relationship. They come back and they say, you know, I didn't even realize I was in an abusive relationship. And, you know, I've gotten out of that one and I've met somebody new, or I'm dating again, and I'm confident enough to put myself out there. That is
that's
huge.
good.
Yeah.
Very
and
nice.
So for sure, it's definitely life-changing. So here is another patient, and it's so interesting. This lady was so shy that on a lot of the pictures that we took before surgery, her eyes were closed. And she just did not like the neck, and also she felt that her lower face had just become loose and just kind of puffed out. And she's a lovely lady, by the way. And like I always say, it's personal to what the person sees when they look in the mirror. And so we did just an elegant face and neck lift on her. I tightened her neck. I tightened her mid-face. I put a little bit of fat in the lower lids.
Looks good.
And also a little bit of fat in her lips, okay? Now, when we put fat in the lips, it's not that we're trying to plump them up, because we talk a lot, and so the fat in the lips actually will disappear. But as the fat disappears, the stem cells recruit blood supply into that area. And so the skin, where the patients are getting the fine lines and things like that, that all smoothens out and it thickens up because the collagen content increases, okay? Now, here's a side profile view, and I want you to look at the jowls on this lady before and after. Things have been tightened up.
Yeah.
But not so much that they look done. It's just her tissue integrity has come back. And that's what happens to us with age. Our body takes quite a bit of beating. You know, if you think about it, on an average day, you take 10,000 steps, right? Okay. And that's 10,000 times that your face and neck are bottoming out, right? Okay. And so, you know, on a day-to-day, just that's why things loosen up. And so when you go back and put things back into their foundation, the patient just looks like themselves, but just more rejuvenated.
Very nice.
Yeah. Okay. Now, this is one of my favorite cases. This is a wonderful lady in her late 60s, early 70s, and she came in and she couldn't really articulate. She just said, I just look tired. And, you know, I pinched her neck, and her neck was definitely loose, but also she had gained a lot of fat there in her neck. And, you know, that's just genetic. It's in the family line. And so we wanted to clean up her neck, but also, I got to tell you, the other thing about her is that she felt that she is... she said that people always look at her and they go, are you mad? Because she had this downturned, you know, and it's the weight of her soft tissues. So this is what we did for her, and we liposuctioned.
Wow, looks totally different.
Yeah, so we liposuctioned the neck and jawline. We chiseled everything for her. We tightened her muscles. And afterwards, she looks like herself. I can't say that she looks like her daughter, but maybe her younger sister. But more importantly, look at the face shots, and before she's not smiling, and afterwards she's smiling naturally, okay? And she just wants to smile more. But I also took a picture of her not smiling so that you could see how we did the work on the jowls and how we cleaned that up.
Look, I'm not
for
trying
her.
to side with you, but this is a dramatic difference. And you said she's close to 70 years old.
Correct.
I mean, nobody would guess that's her age.
That's the beautiful part of it. And then
And it looks natural.
yeah,
right?
thank you.
'Cause I feel like I could spot a facelift walking down the street,
Me
20
too.
yards away.
Me too. And I don't
I wouldn't guess this.
I don't
Nobody would.
like, when I go to Newport Beach or when I go to LA or even, in our town on El Paseo, you can see ladies or even gentlemen walking around who have had facelifts. And I can see that, and I don't personally, I don't like that. And,
Okay.
to me, that's a sign of somebody who did not take pride in what they do. That to me is very important, and I want my patients to have that natural beauty. So this lady has been a patient of ours for skincare and other modalities, but she got to the point where she just hated this, and
Her neck.
it was time to move into a surgical treatment for her.
Okay.
And so essentially what we did for her is I did liposuction, tightened the muscles in the face and the jowls, and she was absolutely
That's a big difference.
over the moon with her result. So for sure, she looks younger.
That's
but
big.
She looks great. And, she's still in the workforce, and she just feels so good about herself. And this is the pick-me-up that she needed. And she is so complimentary. Every time she comes in, she still comes in for facials and things like that. And by the way, Randy, that's the next thing I wanted to tell you is for our facelifts, our lasers, things like that, we always have them come in for a complimentary medical facial. A medical facial is very, very advanced because we take off the top protective layer of the skin, and then we clean the pores, and then we do maybe a peel if they need it. And then we add emollients, minerals, amino acids back into the skin, and then we reseal the skin.
Okay.
And so that helps to keep the patient's results long term. And because
Very
I've
nice.
been in one location for 20 years, I know that because I see the patients.
Okay, good.
All
I'm
right.
going to rush you a little bit, Dr. Zachary, because I want to get all of these in.
No problem. So this lady, again, she just felt like she looked older than she felt, right? And this lady is in her late 60s. And Randy, look at how different she looks when you see the before and after pictures. The results are natural, but also her hair is done differently.
She looks like a completely different person, by the way.
Yeah, and her personality really came out also, and she just has this bounding energy, and she feels on the outside, it matches now the way she feels on the inside.
Do they feel like they're back?
Absolutely. What I'm finding is normally if you got somebody who's in their 50s, they look like or they feel like they're in their 30s. So usually there's a 20-year gap. So somebody who's in their 70s, they feel like they're in their 50s. Some of them even in their 40s.
They tell you that.
Absolutely. So imagine when you actually make them look the way they feel, boom.
Good for you.
That's
Good.
great.
Time for a few more. We're going to rush you, Dr. Zachary.
No problem. So this lady, once again, has been another longtime friend to our clinic, has been coming in for facials and skincare, and she just hated the neck, the bands, and also the jowls right here. And after a deep plane facelift,
Oh, my goodness.
we were able to put everything back in place. More importantly, I did fat grafting to her lower lids, which were hollow, but also did some fat grafting to the upper orbital rim, which was hollow. She looked skeletonized. And so that is very subtle, but it makes a huge difference.
She doesn't look like the same person. I want to make sure we stack these photos on top of each other. It is dramatically different. I'm not trying to be superficial here, but she just looked like a, a regular person that's aging, and now she looks so much prettier. And that happens, right? There's just no doubt about it.
Yes, yes. And
does she want to give you a hug when it's all done, when she's all healed up?
You bet.
Because this is big.
That's the beautiful part of what I do is I'm at the crossroads of people's lives where, I'm honored, and it's really a privilege to take care of them. And then afterwards, when I see them blossom and become happy, they want to give me a hug.
Nice.
I really, really appreciate that.
Now, we should mention, and we're completely out of time, but I mean, you guys have all the laser technology, all the minimally invasive stuff. You even have a center right there on El Paseo that's dedicated to just skin and lasers and things like that. Is that right?
Yes. So it's funny that you ask. It's called Skin Lab by SkinCeuticals. We've partnered up with SkinCeuticals.
I've been in there, by the way.
Yeah. Thank you. Yeah.
Had some of the laser stuff.
Yeah. We have Ultherapy, Thermage, Morpheus, everything you can.
So is it more of a combination of procedures today, where not just the facelift, but taking care of the skin at the same time, and the tightening procedures?
Absolutely. And so, if you have the kind of the wide array of the different modalities, you can really customize it to the patient's needs, to their skin type, to their lifestyle, whether they like to ski or be out in the sun a lot, and all of those things come into play for sure. Randy, I know that we're out of time, but I have one more patient, and this is my favorite patient, my mother. Everybody makes a comment about how wonderful it was to see my mother's before and afters on my show. She's now 78 years old, and she's still looking very good. She just was acting old, and she had stopped telling jokes and had stopped laughing. And so after her face and neck lift, she just perked up, and her smile came back, and she was telling jokes again. And the biggest thing with her was her neck and jawline.
We're out of time. So do you prefer somebody goes online, make an appointment there, or just call your office?
Either or. Just come in and let us take a look at you and assess everything. And sometimes you may need a facelift. Sometimes you may not. Sometimes you may just need a laser or a facial.
So they get to meet you on the console, because you're a local celebrity now, right?
Oh, thanks. Yeah, sure.
Dr. Zachary, thanks for coming on the show. Always a pleasure. Thanks again.
Thank you, Randy.
You've been watching the Wellness Hour news that makes you healthier. I'm Randy Alvarez. For now, I wish you good health.